They gonna ask me, "Oh, you a chiropractor? What you do about this? Oh, have you seen this video? Oh, what about this? Oh man, I don't know about chiropractor."
Hey, so
Woo!
in your Dare to Live Well, Dare to, the number 2, Live Well book, you talk about that everyone needs a chiropractor.
Yes.
Okay? So I want to talk about your perspective on why every single person needs a chiropractor. Now, I think I have a general idea of why.
Yeah.
And you also listed 7 populations specifically. And when I looked through the 7 populations, I was like, that includes everybody in the world in
Yeah.
some degree.
Yeah.
But overall, give us a better understanding of why every person needs a chiropractor, and then we'll talk about those 7 populations as well.
Yeah, that's great. That's great. The reason I was debating, when I wanted to write this book on just healthcare in general, and I was talking about generational health, and I was talking about the healthcare industry and, preventative mindset and integrative healthcare and building a good healthcare team. If I didn't get so many questions every time that I say, if I'm at a function, I don't care what it is, weddings, baptisms, bar mitzvahs, you name it. They gonna ask me, "Oh, you a chiropractor? What you do about this? Oh, have you seen this video? Oh, what about this? Oh man, I don't know about chiropractor, So it's like I think that there is still so much that people truly don't really understand. Even the people that think they know,
Right.
still don't really understand what chiropractic is really about. And truth be told, quiet as it's kept, I'm even talking about some medical practitioners,
Yeah.
because there's a lot of misinformation, disinformation, and there's a whole lot of just stuff that's out there where people truly don't know what chiropractic is all about.
Right.
So, and truth be told, I was one of them. I did not even know, what a chiropractor did. I knew it was probably like a back doctor, and I knew that, maybe if you got into an accident, that's somebody you see. In my mind, with me growing up in Brooklyn, New York, my mind of chiropractic back then was just, if you're in severe pain or if you're in a really, really bad car accident, that's probably where you would see a doctor like that.
Yeah.
And then that was my whole thinking until I just started looking up what are things that I can do. I already had my bachelor's in exercise physiology. I looked up physical therapy, but I just wasn't really vibing. Nothing against physical therapists. I work with physical therapists. We do physical therapy in our office.
Of course.
I just knew that it was still attached to that medical model that I knew that I didn't fully agree with.
Okay.
Right? So I was looking for, okay, what are some other alternatives? And then when I started looking up chiropractic and I saw that, okay, it's based on the premise that the body can heal itself, and that we work with the body to bring about a better scenario, better healing, better optimal function. That message just spoke to me a whole lot better, and the more I dove into it, the more I wanted to do it.
Yeah.
So it's one of those things where with chiropractic, there's 3 main functions. With chiropractic.
Did you just draw a blank?
I know I did. Hold on one second. Hopefully you can edit that part out. So,
Yeah.
so with chiropractic, there's basically, the way I explain it to patients is there is 1, we've got to get better motion of the body. Number 2, we've got to get better positioning of the body. We do those 2 things to create better function of the body. So the reason why, to answer your original question, why does everybody need to have a good chiropractor?
Listen up, y'all.
Because everybody needs to have somebody on their team that's helping their body function at its best.
So
right?
everyone needs a chiropractor for their body to function optimally.
Optimally. right? So, and that means so many different things to different people. And that's why I kind of came up with those first 7 that need to see a chiropractor. But if we were to break down those just 3 different aspects that I told you about, for one, with motion, I think we discussed in the previous podcast, but just to reiterate, the body needs motion to survive, whether it's the heart pushing blood to all of the organs, because the body needs oxygen, and the oxygen is how the body heals. Whether it's the brain sending nerve signals all throughout the body. And the reason why chiropractors focus so much on the spine is because there's so much nerve endings in and around your spine, and then just dealing with your central nervous system. That's basically the main frame of your body. That's like the main electrical system, and that's like the transformer. That's where all the power is going out. Just like if there's a hurricane or a tornado blows a transformer, guess what? You got the whole neighborhood goes out. So that is why chiropractors focus on the spine first, because even if there is any type of irritation to one level of the spine, whether it's at C1 all the way at the top of the spine, whether it's at C7, T1, whether it's at T12, L4, L5, where a lot of people have disc issues and problems.
And let me just make that clear. Top of the spine, middle of the spine, lower part of the spine.
Lower part of the spine, right?
So when you have those issues.
So even if you have something at one level, they call that the intersegmental unit. So that's 2 joints that are put together. And that's one form of techniques. We can get into techniques later on. But even if there's something at one area, it can cause enough irritation, it can cause enough interference that can decrease or increase the nerve output by up to about 60%. That was a study done with the University of Colorado, where they tested cats, where it was deceased cats, where they were testing and just trying to see, okay, well, how fast does the nervous system work, and if there's any pressure on what's called the nerve root. The nerve root is like, as soon as that nerve comes off of the spine, it's right there by your joints, and if there's any kind of pressure. Old school chiropractors, they used to think that it was the bone putting pressure on the nerve. Now we know that if there's bone putting pressure on the nerve, you're not getting up. That is severe pain. But whenever our joints are degenerative and we have arthritis in our joints, or we have stiffness and we have a lack of motion, what happens is that inflammation, that joint, that synovial joint that's around the spine, and there's so many of them, even between 2 segments, you have at least 8. There's at least 8 different connections on how the bones connect to each other. And if any one of those 8 or if all of them are inflamed, then guess what? That's like a little bag of water sitting on top of the most sensitive part of the nerve, which is called the nerve root. And when that nerve root starts to act up, or when it starts to get irritated, now guess what? Just like the whole block is losing electricity, this whole arm starts to lose the electricity. This whole leg starts to overfire. And what's the biggest nerve in the leg? It's the sciatic nerve. And that's where now it's firing because there's inflammation there. And guess what? We're sitting all day at work, and we're sitting all day. So now you put 2 and 2 together, that's what leads to so much issues. So that's why motion is so important. Chiropractic safely, strategically puts motion into the spine. Now, there's so many different techniques with chiropractic, so let me bring this up now. Because so many times people will see like a YouTube video and say, oh my God, I can't do that. Trust me, when I see some of these videos, I'm like, I can't do that either, right? One time, and I mean, listen, come on, y'all, you can't believe everything you see now. Okay? And I think, in the past, let's say 10 years or so with the advent of YouTube and everybody podcasting and things like that, I call it clickbait. Some chiropractors, listen, you're not going to watch their content if they don't have click, 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 right? So at least, you can say, oh, I don't like that. But guess what? You done watched it 100 times and they have 1 million views. So somebody's watching it. It can't be, oh, we don't like that. But yet there's 1 million followers, right?
Exactly.
So it's like, it is sometimes when you see that sound, whether it's something intriguing or something like that, but that's not every single technique. There's so many different techniques in chiropractic. There's over 100, there's probably close to 200 different types of just therapeutic techniques and how to mobilize the body, how to work with soft tissue, how to mobilize the joints, where you don't even have to worry about somebody doing something that aggressive. Now, some people, they want that, chiropractic can do that, that's fine. Or they have to go to that doctor, but let's just start with getting some gentle motion. And that's what we do in our office. We just start with gentle motion in the areas that are the problems, that are areas of complaint. And people are just amazed at how quickly they start getting better. Once you just start introducing motion into the area that has been lacking, begging for motion for so long, but nobody knew it. And guess what? No matter how much medication you take, it's not putting motion in that spine.
It's not. It's
right?
not.
It can put a Band-Aid on that nerve. It can quiet this, symptom over here, but it's not getting what the body's designed to do, which is motion. So that's why to all the naysayers that try to prove chiropractic wrong or say, oh, well, you don't need a chiropractor. Oh, that stuff is not, they still can't doubt, and they still can't deny the fact that that intersegmental unit needs motion to function better, and that's what chiropractic provides, whether you like it or not. Now, the technique we can discuss, and you want to see a chiropractor that has a variety of different techniques so that you make sure that one, they're doing a technique that is to your tolerance, right? And then that's a discussion that you have with every single chiropractor. Some, like me, have many different tools in the tool belt to use. Others are just, I call them like a one-trick pony. They only have one technique. And that one technique gets a lot of people better. And, you just have to do your research and kind of go from there.
Just like you research a restaurant. You like multiple things at a restaurant.
There you go.
So same thing with the chiropractor.
There you go.
So essentially what you're saying, why everyone needs a chiropractor as well, is because it puts motion in the spine.
Yes.
Which allows the nervous system to communicate with the rest of the body for it to be able to function. I remember one time I was listening to you talk and you said that the spine is supposed to move like an accordion.
Yes.
Can you further explain that point?
Perfect. So dealing with motion, because that's still in that's still in the reason number one, which is motion. That goes down to basically when you're dealing with the disc. So the disc is like the little cushion or sponge, or sometimes I refer to it as a jelly donut, but that is the shock absorber as well. Just like we have shock absorbers in our sneakers, Nike was not the one, or the Reebok pump, I'm dating myself, they were not the first ones to come up with, shock absorption in the shoes. They got that from the spine, right? So our body has many different shock absorbers, throughout the body. And they're mostly found throughout the spine because the spine is what's absorbing all of the stress of the body. That's why when we're stressed out, and there's reasons for it, that's why we have so much pain up top here. We've been on our feet and all of that, because those that's the body telling you your shock absorbers are being a little bit more overloaded. So in terms of the body working like an accordion, the reason, God is awesome. The way that the spine gets the fluid that it needs is through motion. And I think that's kind of like divine design because, to me, the creator of the body said, look, if you're not going to move, then sooner or later it's going to start to break down quicker than it needs to. So that's just like another reason why we have to continue to stay moving. And the way that the disc absorb the fluid or the blood flow into the disc, since they're avascular, they count on the segment above and the segment below to feed fluid inside of it. And it does it in like an accordion-like manner. That process is called imbibition. Just like when you're playing an accordion and it's opening and closing. Air is going in, air is going out. The disc, when you're walking, and even when you're sleeping, your body is still moving as you're breathing and your body is opening and closing, right? Guess what? You still have motion even in your sleep.
That's
right?
why you got to go to bed.
There you go. There you go. So, and it's happening on a much smaller scale, but guess
Yeah.
what? That motion is still there.
It's still there.
That motion is still there. So, so that's how the discs are able to absorb the nutrients, the blood flow, the oxygen that it vitally needs to keep the donuts fresh, to keep
Yeah.
the shock absorber nice and strong. But once it starts to lack that
Yeah.
motion and it starts to break down, now we're looking at an x-ray. L1 looks good, L2 looks good, L3 looks good, L5 looks like this. We've got severe arthritis, osteoarthritis, degenerative disc disease of L5, and it's starting to close on you. And the problem with that is, and this is where the urgency comes in, once that disc is gone, it's gone.
Yeah.
Right? I can tell you, look, or you can say, oh, I'm not doing surgery. You don't know how many people that tell me, oh, well, I'm not doing surgery. Well, if you're not doing surgery, what are you doing to prevent it? If you're not going to do surgery, what are you doing to prevent it? Right. Because sooner or later, you have to, like, there's no way that you can have two bones on top of each other, a nerve coming out of it, and you're saying you're not going to tell that surgeon, I'm not going to tell the surgeon that you don't need surgery. There's plenty of people that I have to refer to great surgeons that I know because the problem has just become that bad. Yeah. When it gets that bad, you cannot, there's nothing conservative you can do to open up two bones that are basically rubbing on each other, and you've basically diminished all of your disc space, and you're only 45, 50.
Yeah.
You know, because I don't know, maybe you played pee-wee football, or you were in gymnastics when you were younger, or you played sports when you were younger, and you didn't realize that all of that trauma to the body, it's not about how old you are, it's about how much trauma.
The body,
it's about how much trauma the body has been absorbing, how much we've been loading that shock absorber all throughout. If I have a brand new car, but I drive through any inner city that has potholes, whether it's in Brooklyn or whether it's in Baltimore or whatever, and I'm just driving on potholes compared to I'm just driving on a highway, guess what? I gotta have an old car and I've been driving on a highway, guess what? I have so many older patients where their spines look amazing compared to like a 35-year-old that's been, you know, sports, gymnastics, dancing, whatever you want to call it, where they just loaded that spine and you can see it.
Yeah.
You know?
It's so funny. Before we go into that point, I won't forget it.
Yeah.
But when you said something about when you go to sleep, that the spine is still gently moving, and clients can wake up having back pain, and they think, you know, it's the bed, but you just made a key point that it's already not moving the fluid the way that it needs to. Exactly. It's not the bed.
Yeah.
Okay?
Yeah.
It's the spine not moving the way that it should.
Yeah.
That was just a really good point.
I always tell patients, you know, I need to become an investor in mattresses and pillows, because patients will go out and get, you know, a $500 pillow and a $10,000 mattress, and guess what? Their back and neck still hurts. Right? And I'm just like, well, you know, listen, if you came here first.
That same money could have been invested there. You understand what I'm saying?
For half the price. Like, you know, so it's one of those things where, but, you know, people don't know. And then, you know,
they don't.
People are just going on Facebook and relying on, you know, misinformation. So, you know, a lot of times it's not the bed. I'm not saying that that's not a key factor, but a lot of times with many situations that I see, that's not it. It's just that the spine has locked up so much that it's unable, it's not even able to move when it's supposed to be restoring itself. The body is always healing itself at night. The body is always kind of resetting. But if it's been loaded up and you've been sitting on that chair all day, bad ergonomics or whatever you've been doing, now at night it can't even budge. And guess what? As soon as you wake up in the morning, it's so hard getting out of bed. It's killing me. But once I get moving and once I get on my feet, I'm fine. It's not minimizing. Well, it's real bad in the morning, but once I get moving, I'm fine. But it's still real bad in the morning and you're ignoring that. So we have to address that. And there's many different modalities like spinal disc decompression along with chiropractic that help to restore the disc back to its proper state of health.
That's really, really good. Really, really good. So let's jump into a couple of the different populations that you mentioned in the book that could really benefit from chiropractic care. The ones that I specifically want to talk about is military and veterans.
Yeah.
Pregnant women and the babies.
Yeah.
And then everybody got scoliosis. The doctor told them when they was younger that they got scoliosis.
Yep.
But if you
let's deal with those three because there's a lot. I mean,
I
that's all. That's all. I think each one could have their own podcast, right? So let's deal.
Well, it was 7 actually.
Yeah.
So it was the young adult athlete, it was the pregnant mom and the baby, it was military and veterans, it was anyone who had scoliosis,
Yep.
It was the workforce,
Yep.
And it was
auto accidents.
Auto accidents. And then what was the other one? Number 7. I named about 5 of them. So you got to come with the last 2.
You said pregnancy?
I said pregnancy.
I might have to look in the book because it's been a while because I do it so much. But you said workforce, you said pregnancy, scoliosis, veterans, which we're going to talk about.
The young adult,
young athletes.
The auto accident case, auto accident victims.
You know what? I'm stumping myself. Go ahead and grab my book.
Go ahead on and grab the book. Let me look real quick. I think that it is.
It's in the chiropractic chapter right there.
Yeah, I'm right here. People.
Now I'm stumped.
See, pregnant.
Because I see so many.
Young adult athletes, senior citizens.
Oh, seniors.
The senior citizen. He forgot about you.
Oh, I'm sorry. Mother Jones, I'm so sorry. You need chiropractic too.
Everybody falls under.
Yes.
In the world falls under one of those categories.
That's a huge, swath of the population. If you look at all of those 7, and there's a reason for each population though, and it's because, and I think the reason it just comes top of mind is because I'm in a practice where we see all sorts of different conditions. Now there's some chiropractic colleagues that I have, they only deal with women and children.
Yeah.
There's other chiropractic colleagues that I have, they only deal with auto accidents. With me, I see it all. I focus in on some of the tough cases and people with degenerative disc, neuropathy, and my specialty is really dealing with those that haven't had help in other offices, and we try to look for the root cause, and we really try to, couple chiropractic with a lot of the other state-of-the-art modalities and things of that nature to really kind of give it the edge and still help the body heal and things of that nature. But yeah, everything from seniors to babies. I had one chiropractor, when I was first in chiropractic school, he used to say, you know what, chiropractic is good from the womb to the tomb, And it was an older guy. I never forgot it, but he was a structure and function. But it's true when you really think about it. Like I just adjusted a baby, maybe 4 months, just yesterday. In the same day, there was a pregnant mom. She was actually going to get induced that night, but she wanted to come in and get adjusted in the morning.
Yeah.
But I saw her all throughout her pregnancy, and just dealing with pregnancy, the body, biomechanically, the body changes.
Yes.
And so many times, I think one of the major reasons why I really stress the importance of chiropractic with pregnancy is because we have this healthcare system that it's like women are just supposed to just suffer through pregnancy, and there's no real solutions that are given to them outside of, maybe just take a little bit of, aspirin or this, that, or whatever, or, lay this way and use ice. But there's so much benefits that the pregnant mom can have, one from pain relief, from dealing with the joints that are biomechanically shifting and moving and the weight redistribution of the body, two, allowing the chiropractor to remove the interference from the nervous system and from the spine so that whatever nerve flow is happening throughout the body can go right into the womb and go right into the baby, and we're not dealing with any type of interference in the lumbar or in the sacral regions. So and then just better sleep. And most of my pregnant patients, this is crazy, even the young lady that I saw yesterday, she's doing better pain-wise on the day she's about to get induced, she's feeling so much better basically on the day of that she has to give birth compared to when she was in her first trimester, second and first trimester when she was dealing with pain when she first came in.
And I was going to mention that, like, it allows for an easier laboring process.
I've heard that and seen that so many times before.
And I've heard that with chiropractic, if the baby is breached, you guys have a method to help.
It's called the Webster technique. Okay. Yes, and and that is a proven method. It's been researched and all to help naturally turn the baby so that there doesn't have to be an aggressive surgery and things of that nature.
Yeah.
So, it's just dealing with allowing the pregnant mom to function better even during the birthing process.
So we talked about the womb.
Yeah.
Let's talk about the tomb.
Okay.
So let's talk about the seniors.
Okay.
Why the seniors need it? Because they love their little cane.
There you go.
And their walker and bending over on a shopping cart while they're shopping.
Yeah.
Y'all, we got to talk about them. Can we talk about them?
We have to. I feel like every senior needs to have a good chiropractor on their team. Now, to my seniors, I love y'all. I don't want you to think that if you go to a chiropractor, they're just gonna do some big giant wrestling technique, that's just gonna, get that out of your mind, okay? Because, to all the seniors that just discovered YouTube, stop watching those chiropractic videos, because that is scaring you, okay? You do not do that with the seniors. Let the young people worry about those crazy techniques, right? To seniors, you need motion. There's been a lot of wear and tear on the spine. If we just talk about it as it is, the body, it does age and the body does wear down on you. And when you have arthritis in the joints, what happens is that those shock absorbers that we spoke about, they do get thinned out and they do get down to a real small amount. So that's even more vital and imperative if you want to continue to function better and if you want to continue to have a good lifestyle where you are being able to play with your grandchildren and do the things that you want to do and not have to rely on a cane or the assistive device or be in a bad position so bad where you're hunched over and you can't even look up without pain. Because I see that a lot too, but it has to start with thinking from a preventative mindset, which is what we spoke about early on. We can't wait till we're 80 to say, okay, now I think I need to see a chiropractor.
Right.
And I've seen that so many, I'm amazed that there's patients where they might be 75, 80, I'm their first chiropractor, and nobody's even told them that they had scoliosis, or nobody's told them about, what's the condition of their spine, and what are things that they can do just to feel better. And the thing about it is that most of the seniors that we see in our office, it's very light techniques. Maybe we'll give them some spinal decompression. We'll perform some activator, which is a very light and very low force adjustment using a very small tool just to kind of insert motion into the spine, and they start feeling better so much quicker than they thought they would because they were dealing with pain for so long, but they just didn't realize that, man, I just had to get certain things moving and I'm feeling so much better.
Yes. What about, let's touch on the scoliosis, because we've had clients that have come in and they said, when I was younger, they told me I have scoliosis. And sometimes we check the x-rays and we don't see it. And they may just have like a lean, but some obviously have a scoliosis. So why is it important specifically for scoliosis clients to get a adjustment? Work with the chiropractor.
So defining scoliosis, if somebody's your first time hearing it, your spine, when you're looking at it from the back, if you're looking at me and Nurse Ebony, your spine is supposed to be straight. If you're looking at it from this angle or looking at it from the back. But if there's any lateral curvature or lateral deviation of the spine, and it's in a curve, I would say greater than, let's say, 15 degrees, then we're talking about something called scoliosis. And scoliosis, the reason why that causes a good bit of pain for some people, it's asymptomatic. So there's some of you right now, you're watching, you might have scoliosis and you don't even realize that you have it because maybe it's not 30, 40, 50 degrees, but you might have 20 degrees of a bend in your lumbar or your lower back, or you might have 15 or 30 degrees in the mid back. why scoliosis matters and why it's important for them to see a chiropractor is because when that spine is not in its optimal position, which is actually reason number 2, let's talk about that. Remember we spoke about motion is a real big reason why people need to see a chiropractor. The second one is making sure that things are properly aligned. The reason why you want the spine to be properly aligned is because there's so much research, not even on the body, just simple biomechanics, simple physics. If the way that your body is structured and the way that it's designed and the curves of the spine, it's meant so that your joints are holding up a body 150, 200 pounds or whatever, and it's holding it with ease. Now, once something starts to shift out of place, now the joints that are holding up the body with ease, now instead of the weight being evenly distributed throughout the spine, now all of your weight, because of how your body is shifting, all of your weight from your upper back and your torso is now only, now L5 is holding most of the weight. And now you wonder why L5 is looking small and all the other joints look fine. That's why I always tell patients when they say, oh yeah, this is age related, I'm supposed to have degenerative disc. And I'm like, well, if that's the case, why is it that it's only C5 that is bad on this x-ray and all your other joints look fine? Why is it that it's only L4 that's degenerative and looking small and all your other joints look totally healthy and totally fine? It's because of that weight distribution and your body has learned to compensate or overcompensate so that you can get out of pain. But you can't stay in that position. So going back to scoliosis, your body is naturally on a baseline level stuck in certain positions that is building up more stress in certain parts of the spine. And that is not healthy for those disc spaces, and that is not healthy for the spine. And I'll take it a step further. It's not healthy for the nerves that are exiting out of that area. We call that the apex of the curve. So if your spine is supposed to be like this and it's curved like that, right around here, and almost guaranteed every scoliosis patient, where they have the most pain is where they have that bend in the spine. So what chiropractic does is safely looking at the scoliosis patient, what are the proper techniques that we need to do? And there's so many techniques that are heavily researched on scoliosis that deals with the biophysics and the positioning and the how to restructure the spine, how to safely do that. And what we're doing is really trying to help you manage. Because if it's true scoliosis, we can't just say, hey, I'm taking a 30, 40 degrees curve in your spine and I'm gonna make it straight. We can't do that. What we need to do is the sooner we know about it, and that's why I'm encouraging all of the parents, to bring in their kids and let them get checked and all of that, so that the sooner we know about it, the better we can manage it conservatively. So at least we can show you the right exercises, the right stretches, do the right adjustments to keep taking the pressure off of those pressure points that are building up, so that the student does not, or the patient does not end up dealing with so many issues early on, right? And they can function well even with scoliosis.
And I'm glad that you made the point about the kids, because I was going to bring that up if you didn't. But also too, if you see a surgeon and they tell you that they can straighten your spine by some rods and some pins and some plates, that is untrue. That is untrue. Okay.
Because the spine is still bending. What they're doing is they're just trying to stop it. And let's just talk about that. I'm never anti-surgery. Like I said, I have to refer patients to surgery, but so many people, sometimes they'll go and they're looking for a conservative solution, but they're going to a doctor that treats with an aggressive modality and technique. So, if you don't want surgery, chances are, because they're gonna how they were taught, and it's not that they're wrong. It's just that that's how they were taught. Just like I was taught in my 4 years of schooling, I was taught, okay, if I have scoliosis, I'm gonna manage it this way. They're taught, okay, if you have X degrees of scoliosis, we're gonna manage it this way. Insert the rod here, Harrington rod this way, and go. And that's their method of choice. So it's up to you to say, hey, listen, which treatment do you want to do and how soon do you want to start it? Because sooner or later, if you let it get out of hand, and there are some people where theirs are just that aggressive, where it may have to come to that, but those are so extreme. That's such a small segment of the population of people that do have scoliosis. So much more can be managed and can help to reduce the stress on the body and also help to tame it so it doesn't get too aggressive and too out of hand.
Yes, and if it's not handled early and or regularly, it can cause body disfigurement where you see people who are, hunched over or hunched in position like this, and you don't want that, you know what I mean? So I'd rather address it early in a more conservative way than to not dress it at all. Yeah. So, okay, we mentioned the pregnant women and the baby, so the womb. We talked about the senior citizens to the tomb. And you also mentioned, I really wanted you to talk about the clients that have the scoliosis. All the populations are very important, you guys, but is there any other population that you kind of wanted to address? The military patients or the workforce? I feel like you've kind of already addressed.
Yeah, we touched that, just dealing with ergonomics and people that are on their feet. So we see a lot of civil servants, the firefighters, police officers, but construction workers, but anybody. But everybody always thinks in terms of ergonomics, they feel like, well, they're the ones being stressed at work, I'm fine. But actually, if you have a sedentary job, your spine is in more demand. Your spine is in more demand to see a chiropractor because at least they're getting up and they're moving. You're sitting still all day, and that's more detrimental to the spine. You know what? I would say, for some reason, I'm thinking of like the young athletes.
I knew you was going. I know. You was going to do
that.
I knew it.
The reason for it is because, I'm just thinking of prevention. That's probably why I was going to go there. And I'm seeing like my practice is filled with so many people in their, late 20s, 30s, 40s. That's a good bit of my patient population.
Wow, that's great.
And when I dig back into their history, it was, I played and I practiced every day, and it's just, there's so much demand that they're putting on the spine at an early age. It just makes sense, even if they were doing a preventative care plan. But now there's chiropractors, and I got some great colleagues that are sports chiropractors, and they can not just do the adjusting, but also work with the knee, work with the joint, and doing all these different soft tissue techniques and really getting optimal function out of a sports-specific exercise and things of that nature. But just the sheer fact of you putting that excessive load on a spine that is not even fully formed yet, it's so important for you to see the need in your child. So I'm talking to the parents because the kids can't just go by themselves. So I'm always in praise of a parent who actually one just brought on the other day. She's in a dance school, and the dancers, they practice, sometimes 3 hours a day, and it's nonstop, and they're on their feet and they're bending and they're twisting. And it's not normal for a child to be dealing with pain. Remember, we spoke about pain being at the tail end of something wrong. So for a 12-year-old saying, "Mommy, I'm waking up with pain," or "Dad, my back's hurting. I'm catching at football, but for some reason after practice, my back's killing me." Listen to your child and do something early about it. Send them to a chiropractor. Do not medicate that child. Right? And teach them early that it's easy to just take something and forget about the pain. That is the worst thing that you can, in my opinion, that is the worst thing that we can do, because now, as they get older, they're looking for that quick fix. And they're looking for that quick fix rather than realizing, you know what, if I'm putting more demand on my body, I've got to put in more recovery. And I've got to put more investment in recovery. I just looked up, either whether we're talking about LeBron or Devon Henry that just came onto the Ravens, and they talk about their recovery process and how much money they're spending.
$250,000.
If that, a year on their body, and that's because they know I'm putting these heavy periods of demand on the body. So what do I need to do to at least offset and allow the body to recover. And if I know that the body's designed to move and I know that the body needs to be in a great position, then why not see a chiropractor?
You said Devon Henry. Let me correct you. I know you might not be a Ravens fan, but we part of the flock up in here.
Oh, yeah.
Candid Convos with Nurse E is with the flock. Derrick Henry.
Oh my gosh. You know what? I'm actually thinking of my Devon Henry is actually my frat brother. How you doing, Devon Henry?
Derrick Henry. But
Derrick
yeah,
Henry, yeah.
It's funny you brought that up because I just did an episode with my brother where it was talking about athlete to injury.
Yeah.
And he was on and he talked about what happened with him. He played football and I said, come on in and just get an exam. You know what I mean? I'm your sister. I work there. Go ahead on and get an exam. And we saw some changes in his spine. He had a lean. One leg was shorter than the other. He doesn't mind me telling all of this. But he had some changes and he didn't get treatment at that time. He was at the gym. He did some type of move. He heard a pop. He's coming home bent over like this. Yeah. I said, what happened? He told me, I said, you have to go to the chiropractor. Yeah. Now he swears by it. Yeah. Wears his back brace all the time. You know, like I told him, I said, all the football players all the Ravens players need to be at the chiropractor. Yeah. All of them.
They have them on the team. They're on their team already. Okay. I know the ones that work with them. Okay, so, and that's the thing, like, because they see the benefit of it. They know that there's a benefit there.
Good.
And, you know, the body is always going to give you warning signs. Whether we pay attention to them or not, that's on us. But the body's always giving us warning signs. The body's always giving us, maybe I shouldn't have lifted that. I think I squatted too much. I think I've been dancing too much, right? And it's just giving you that warning sign. It may not be severe pain, but if we don't pay attention to that warning sign, you know, it's coming. The pain is coming.
I hurt my knee when I was dancing. I might need to get it.
Oh, Lord.
Get it fixed.
Oh, Lord. There we go. There we go.
I used to be a dancer. That's how I did it.
Yeah.
And then I used to cheer.
There you go.
So all the things.
Listen.
I just want to thank you so much for talking about why everyone needs a chiropractor. And I could not agree with him even more. Yeah. You know, and so thank you for coming on. Thank you for sharing your knowledge. Thank you for writing this awesome book, a tool that anybody can use to help with bettering their health and getting better understanding of developing a preventative mindset and understanding why everyone needs a chiropractor. Yeah. So until next time, guys, thank you. Be blessed.
God bless.